Hello there. I am Melissa Cady, a board certified anesthesiologist and board certified pain medicine physician, and also the owner of Painless Wellness. You're watching this video to get an understanding of what to expect on the day of your procedure for deep sedation. Whether it is myself or a trusted colleague, one of us will speak with you virtually or by phone in some circumstances before the day of your procedure in order to review your medical issues and create a plan for your anesthesia in a less rushed and more relaxed state. And please bring up your concerns or questions during that visit. You will typically be informed of the surgery center within the week before and or up to the day before as to when you should arrive for your procedure, which typically is about 1 hour prior, but this can vary as well. They will review the policies for your day of your procedure and remind you of certain things to do or not do, including not eating at least 8 hours prior to procedure time. However, if you are on any medications that slow your gut, such as Ozempic, Mounjaro, etc., or have any medical issues that could slow your gut, like diabetes, then you may be told to hold solid foods for longer. When you arrive to the surgery center, you will be taken back to a preoperative room where a nurse will measure your vital signs and let you sign consent forms if that has not been done already. You may also be asked to give a urine sample to assess if you have tobacco in your system and or if you are a pregnant female. If those items are not positive, then they will go ahead and proceed to have you change into a gown. You may also be asked to take a couple of pills such as Tylenol and or gabapentin with a couple sips of water. You will typically have your IV placed by a nurse in that pre-op room, and feel free to discuss any concerns you may have, whether it's related to arm restrictions or struggles that you've had in the past with getting an IV. At some point, you will get to meet your surgeon to ask any last minute questions or to receive any markings or pictures that the surgeon may like to do. Also, prior to going back to the operating room, you'll be seen briefly by your anesthesia professional to verify a few things and to see if there are any last minute questions. When everyone is confirmed to be ready for you, then you will walk with the nurse and or your anesthesia provider to the operating room and be guided to lie down on the bed. At that point, your anesthesia professional will immediately give you some relaxing medicine if you'd like to help calm down your nervous system just before placing all of your safety monitors and giving you some oxygen gently by a nasal device called a nasal cannula. Once we are happy with the setup, then your anesthesia provider will proceed to give you additional medication, including propofol, to induce a slightly deeper sleep. The primary focus is to ensure that you are comfortable and sleepy without any compromise to your breathing. As long as you're breathing well, then we can keep you sleeping well. Many times after you are asleep, we can use a small mouth airway to keep your tongue down and allow an adequate passageway for you to breathe without obstructing. If you have sleep apnea, please let your anesthesiologist know. Most people do not remember anything, but on rare occasions, someone may recall a brief moment of hearing a voice or opening their eyes. Do not worry, we are watching you, keeping you safe, and want you to be comfortable. We can administer additional medication at that time. However, without a breathing tube, we do need to ensure that you are breathing well on your own. Whether you are having a laser or other procedure, you will have some medication already on board, but there will also be orders for the recovery room nurse to give you additional medications if you need them. By the way, if you're having a blepharoplasty or upper or lower eye work with your procedure, then you'll receive some eye ointment, which can create some blurry vision initially. In many cases, your surgeon will use a local anesthetic to minimize the need that day for long-acting opioids, which are known to cause nausea, severe constipation, and urinary retention. Most patients do not have nausea from the medications we give during your deep sedation, especially because propofol has anti-nausea properties. If you have severe motion sickness while in the front seat of a car, please let your anesthesiologist know, as there is a medication that can be considered as part of your anesthesia plan, such as a scopolamine patch. Our goal is to keep you safe on a day that many patients are understandably nervous. Please let us know if you have any particular concerns or questions during your anesthesia consultation. Thank you.